7 bizarre cases that left doctors speechless. Doctors are trained to face the unexpected every day, but some cases leave even the most seasoned medical professionals lost for words. In this video, we delve into 7 of the most bizarre cases that left doctors speechless. Cases so strange, they could only be described as medical mysteries. Buckle up, as we begin a journey into the world of the unexplained. Case 1, the man who couldn't sleep for 11 years. It was a quiet evening in a small town, when a 34-year-old man, who hadn't slept a single minute in over 11 years, walked into the hospital. His eyes were bloodshot, his skin pale, and his body showing signs of extreme exhaustion. Despite trying every sleep aid, every therapy, nothing worked. He'd been awake for over 4,000 days. The doctors had no idea how to explain his condition. The strange thing, his body was still functioning. He had no mental breakdowns, no psychosis. He could walk, talk, and eat. But sleep, it eluded him. His case baffled even the best neurologists. After multiple tests, the only conclusion the doctors could reach was a rare condition called fatal familial insomnia, a degenerative genetic disorder that prevents the ability to sleep. And eventually, it leads to death. But this man was still alive, a walking paradox. His case remains unsolved to this day. Case 2, the woman who couldn't stop laughing. In another part of the country, a woman in her 40s was rushed to the ER in a state of uncontrollable laughter. It started as a simple joke at work, but hours later, she was still laughing uncontrollably, unable to stop, her face flushed with tears. She had no history of mental illness, no signs of a stroke or neurological issue. The sound of a light, unsettling laugh echoes in the background. The doctors were puzzled. Could this be a psychological issue? Was it a seizure? As time passed, her laughter became more manic, bordering on hysteria. The diagnosis: gelastic seizures, a rare form of epilepsy that causes uncontrollable laughter. The cause: a benign tumor pressing on her brain. The laughter, however, was just the beginning of her strange battle. Sound of a faint beep, followed by silence. After the tumor was surgically removed, the laughter subsided, but it raised an even more haunting question: what else could the brain be hiding? Case 3, the woman with 5 heartbeats. Next, we meet a woman in her early 20s who came in complaining of chest pains. Upon examination, the doctors detected an irregular heartbeat, a common occurrence. But when they hooked her up to the heart monitor, something bizarre happened. There were 5 distinct heartbeats on the screen. Fast-paced heart monitor beeps fill the soundscape. She wasn't just experiencing 1 heartbeat, but 5. The doctors were stumped. How could this be? Was there an anomaly? Was her heart enlarged, beating in overdrive? Pause, creating suspense. It turned out she had a rare condition known as supernumerary heartbeats, where the heart sometimes develops additional electrical pathways. In her case, her heart was producing extra beats, almost like a shadow of a second heartbeat. After several tests, it was discovered that she was born with a minor congenital defect in the electrical system of her heart. A true mystery that doctors couldn't have anticipated. Case 4, the patient who was living in 2 places at once. In one of the most puzzling cases ever recorded, a patient in her 50s was brought to the hospital after suffering from severe headaches and visual disturbances. What the doctors didn't expect was that she began reporting seeing herself in 2 different places at once. At first, they thought it was a mental breakdown or hallucination, but the more tests they ran, the stranger things got. The sound of a confused whispering and frantic scribbling. MRI scans revealed something shocking. Her brain was showing signs of what seemed like 2 consciousnesses occupying the same space. The doctors were left speechless. Could this be a new form of neurological disorder? No one had ever seen anything like it. As the patient recovered, the confusion cleared. It turned out, she had a rare condition called dissociative identity disorder, often misunderstood as a split personality disorder. But the brain scans, which initially seemed to show 2 different people, were actually highlighting 2 separate states of consciousness coexisting. Case 5, the man with an extra finger and toe. This next case is not as mental as it is physical, but it is no less strange. A 32-year-old man came into the clinic, and what doctors first noticed was his extra finger. At first glance, it looked like a simple case of polydactyly, a condition that causes extra digits to form. But when they examined his feet, they found something even stranger. He had an extra toe, perfectly formed, where no toe should be. Sound of a doctor's pen clicking as they make notes. The medical staff couldn't believe their eyes. Not only did this man have an additional finger on his left hand, but his extra toe was fully functional, complete with its own nail. The anomaly, a genetic mutation that caused his body to grow extra digits, but it was also accompanied by other deformities in his joints, making the extra finger and toe functional in a way they weren't supposed to be. Case 6, the patient who was frozen in time. This case took place at a hospital renowned for dealing with the most difficult neurological conditions. A patient came in who had been suffering from what they described as time distortion. She could no longer perceive the passage of time normally. Days felt like minutes, hours like days, and moments felt like years. Ticking clock echoes in the background, growing faster. The doctors ran extensive tests, suspecting something as common as extreme anxiety, but the tests came back normal. However, something even stranger was at play. Her brain had entered a state of altered consciousness known as time perception disorder. It's a condition where the brain's ability to track time is completely distorted. But for this patient, it was so severe, she had a hard time distinguishing between the present and the past. Case 7, the ghost patient. Our final case takes us into the eerie world of the unexplained. A 30-year-old woman was brought in after being found in a strange state of wandering. She had no memory of how she got to the hospital or even how she got home. But what made this case so bizarre was the eerie detail she couldn't explain. Her body had no physical trace of illness or injury, despite having been missing for 3 days. The sound of wind howling, then a sudden eerie silence. The staff tried to piece together her movements, but what they found only deepened the mystery. Security footage from the hospital showed her walking down the halls, but she never seemed to leave her bed. Was it sleepwalking, a psychological breakdown, or something even stranger? These cases remind us that even the best doctors can be left speechless when faced with the unknown. Each of these patients experienced something that defied medical logic, challenging everything we know about the human body. These mysteries remain unsolved, but they also remind us that science is always evolving and there's still so much we have yet to discover. Sound of heartbeats fading out, followed by a soft, ominous tone. Thank you for watching. Don't forget to like, share, and subscribe for more captivating medical mysteries. Who knows, the next case might be something you never saw coming.